Hi, good afternoon. I'm Christine. Thanks for coming by. I wanted to provide some videos for people diagnosed with vertigo that have a really hard time deciphering the handouts and the wording while doing the treatment themselves. Um, this one specifically is for loss of balance to your left heel, and more so with your eyes closed. So that is a cupulolithiasis, meaning the otoconia, which are the little tiny crystals inside of the vestibular system, have moved out of the little house they live in and into the canals, and then they stick. So if you've been diagnosed with left posterior cupulolithiasis, this video can talk you through how to do this, like I do when I treat patients with it. And it's about, setup time, if you decide you want to do it yourself, would be setting up a pillow at each edge of your bed or couch, so that when you position in one movement, your head will be on a pillow on one side. And then when you transition to the other movement, your pillow would be on the other side, kind of where your head and feet will be. You could use your phone as a timer, and you'd want a vibration tool like a mini massager. And the place you'll put it, I'll show you, is called the mastoid process, right there. And it's kind of hard to do it yourself with holding a phone, positioning yourself, doing the vibration. I understand. That's why I'm doing videos for people, because a lot of people live alone, or they might try it and their head position is incorrect. And then this crystal system could move into a different canal, and then you have another issue. So I would recommend starting before you do the positions for the video on a floor, and feet are together and eyes are open, and see how you sway, which way you go. You can look in the mirror, you can feel it, and then that's 30 seconds. And then in a corner of the house, for safety, try it with your eyes closed, feet together. Now, mind you, this is for people who've been cleared to do it alone, that you're not a fall risk. It's more for maintenance. This isn't for people who are spinning. This isn't for people who are in the hospital. It's for outpatient clinic settings after you've been treated, and it's more for maintenance. So for safety, make sure you're safe enough. Don't do it if you feel like you're going to fall. But this is how you'd know what to do. So it's called a modified cat-sib balance test. So if you're standing in the corner with your feet together and you close your eyes and you lose your balance to your left heel, not because, here's the thing, not because you're throwing yourself away from your right heel, not as a, oh, I didn't want to fall that way, so I threw myself this way. So it's kind of hard to know unless those are the circumstances. So you're somebody who's standing with their eyes closed on the floor, feet together in the corner, and you keep losing your balance to your left heel, but you can't get to center and you can't stay there. And then you move on to the cat-sib pose number 3, where your feet are on a non-compliant surface like a pillow or cushion. We prefer balance cushions for this, to take away the feedback from your ankles and feet. And that's how we kind of look at, okay, what's happening with the balance center, which is your navigation center. So again, if your eyes are open and you're listing a little, but you can stay in the center, but then you close your eyes on this foam pad safely in the corner, and off to the left you go back on your heel. This is for that. So when you're ready, I'm going to talk you through how to do this. Obviously, I can't do videos right now by myself and be on a mat or a plinth table to show you, but I'll talk you through it. So you're going to sit on the space that you're going to get treated for yourself, and you're going to turn your head to your right, 45 degrees. And then you're going to lie back on your left onto this pillow you put down on this mastoid. And so go ahead and do that. And I'm going to give you a timer here. Set timer 2 minutes.
2 minutes, starting now.
So this timer, when it goes off, you're going to, from that time, move your body, but not your head. Your head's going to stay in this 45-degree position. And you're going to move, I call it across the rainbow, all the way to the other side of the mat. So your face is planted towards the floor on the pillow, with your left eye looking at the floor and your right eye looking at the bed or the plinth. The key for this is that head has to stay in this angle. And your body moves, your head stays still. So while you're on your left back side of your head, technically the lateral side, think about if you're dizzy, if you have lightheadedness, if you feel any pain, any nausea, just kind of make note of what you're feeling, because these are the symptoms for you that tell you when this canal needs to be treated. Everybody's different. Even nausea, tingling in the feet, hands. It's amazing what happens when we correct this with a head maneuver. This is the head maneuver. So again, 45 degrees, doesn't move, 7 total minutes to stay in this head position, but your body will change. So you have 27 seconds to prepare your body to move to the other side where the other pillow is. So move your feet down, get prepared. When this goes off, you're going to move the whole body over to face plant on the other side. Head stays in this 45 position. Do not move it. Have your vibration tool ready. Here we go. And transition. Okay, so now you're there, you're face down, left eye's looking at the floor, right eye's in the pillow. Have your vibration tool. You're going to vibrate behind your left ear. Set timer 2 minutes.
2 minutes, starting now.
You're going to kind of hang out here, face down, vibration behind that ear. Keep on that bone. You're moving these crystals now slowly back into their house again, their little space that they live in normally. Some people will listen to this and say, oh, great, it's fixed. So cupulolithiasis tends to be chronic. It's caused from many different things. It could be from a head injury. It could be from a car accident. It could be from trauma. It could be from getting the flu, COVID, falling down, even going to the dentist or having your hair done. There's so many things that cause these crystals to stay out or pop out that most people don't know that. And they think, I don't have vertigo because I'm not spinning all the time. Well, some of us overcome the acute spinning stage. It might move into chronic stage, and then you've become someone who lessens what they do in life. Well, I don't do that anymore because I'm dizzy, or I don't know why I stopped looking around or moving my eyes. So there's a lot of different things we compensate with and we just forget about until it goes, oh my gosh, there's so much going on now in my mind, in my body, in my world, that I can't do things I used to do. And that isn't normal. If someone tells you you get old and it's normal to lose your balance, it's not. There's some reason. It's just really hard to find it. So try this. This is a safe maneuver. So we're 3, 2, 1. It's going to go off. Stay in this position. Don't move. Just stop the buzz. And now we're going to stay there 3 more minutes. Set timer 3 minutes.
3 minutes, starting now.
So the buzzer's off the ear, but you're in the same position facing the floor. And you're just kind of feeling your body. But I'm teaching as I go because this is what I do in clinic, but it's really hard to remember all this when you get home. If you haven't done it for years, I've done it for years. If you haven't experienced it, if people are trying to help you, it's just a really hard system to understand. It's not voodoo magic, which people tell me. It's not. It's science. Our inner ear system that is our navigation for orientation with gravity and life and movement is so overlooked. People go to MRIs and CT scans, and what if it's this? What if your body doesn't have to hurt on that left posterior side because that canal crystal system's out? What if your balance can be better? You can walk easier. You don't have to think so hard about not falling. So kind of keep these things in mind. What's changed for you? And then when it comes back, that's how you'll know what to do again. This same system needs to be treated and managed. So you need to do that self-balance test every day, every single day. I know. But I say to people, how old are you? And then how many minutes is that in your life? And aren't you worth 2 minutes in the morning to stand up and test your balance and then treat yourself to have your better day, to not have to worry until it comes back? It's just like eating good food, exercising, or being mindful. Have a good self-habit, a self-care habit. This is what this is about. So you're getting to 45 seconds-ish. And then when the timer goes off, you're going to slowly sit up from that same side. Don't spin around. Don't go to the other side of the bed. Sit up from where you are. So don't do it yet. It's just I'm preparing you. So because it's a lot to do. I get it. I know I'm uncomfortable, or people say, I'm feeling nauseous or lightheaded, or just kind of make note of these symptoms, because this is the way your brain's identifying this canal's out. And then write them down. Write these things down, because for you, that's the message. That's your system telling you what's going on. It might be weird, doesn't matter. It's your system. It's just talking to you. So go ahead and sit up slowly on the same side of the bed or couch. And sit here for a minute. Set timer 1 minute.
1 minute, starting now.
And just look straight ahead. And just identify if you feel dizzy or lightheaded or nauseous or painful or tingling, have to go to the bathroom. Just notice. Pay attention to your symptoms. You don't have to live and not be able to walk and stand because of vertigo, or look around, for example, because of vertigo. You can do this for yourself. Listen to this as many times as you need to when you need to do it, or just to learn. I mean, I went years and years of schooling and weekend seminars and going through my own treatment to know how to do this. And that's why I value it so much. It works. Reduces pain and life stress and anxiety and fear and all that. Okay, so there's 1 minute where you're sitting, noticing symptoms, looking straight ahead. If you haven't had a pen and paper nearby, just find time after this is done to go write it down. And it might take a day or two to feel kind of like, it worked. But the more you do it correctly, it's almost like immediate. So you get up from here and go stand again in the corner, feet together, eyes open, retrain your system to navigate upright. You might lean back to the left again, but most likely you'll notice you pop right back to the middle. You might sway differently now. Circles are good if you go in circles. That means your system's like recalibrating. If you now notice, I'm leaning another way. Oh, and it's with your eyes closed. There's more videos for this. So make notes. If you lean right posterior, now you're not trying to get off your left heel and you're not trying to prevent a fall from the left. There might be another one underneath. And I see people with multiple canal issues, 4 out of 6, 6 out of 6 that are off. And they're so surprised that no one found it. It's because tests like MRIs, CAT scans, blood draws, they don't notice it. Even Meniere's disease is diagnosed for this kind of thing. And maybe some have it and vertigo. So just kind of pay attention and talk to your doctor and your therapist, if it's not me, about, oh, I'm noticing these things. Good. All right, so for now, we worked on left posterior canal, cupulolithiasis, meaning the crystals are stuck. If you have osteoporosis or osteopenia, more important for you to do this more frequently to stay aligned, to keep your body up. Because if it's chronically there, we fall down because gravity pushes us down, and then our system gets the feedback it needs. And then when it's treated, oh, I can stand up again. Wow. Huh. Good stuff. Okay, on I go to the next one. See over there, remember to like, thumbs up, share if you find this information might be beneficial to somebody, but I'll note, don't just self-treat without a diagnosis. So get one from a clinician who specializes in this. We don't have to have the certification, but we have to specialize and know what we're doing. So don't just randomly treat yourself. Safety first, because there's different things that could cause this to happen. It's just, this is for the people who know this is what I need to treat based on what I've been through an evaluation. I'm an occupational therapist. There are physical therapists who do this as well. It's knowing who you're going to. You want to ask them, do you treat all 6 canals? Do you assess for all 6 canals? You want to ask them that, because most of them are hiding. These little crystals hide. And maybe not all therapists do that. And maybe not all doctors do that. So there's all 6 to look at, and there's 12 different ways to treat them. It's very complicated. So subscribe to this channel if you find this is helpful to you. And just know I'm taking my personal private time on my weekend because I know how important this is, that you have a better quality of life. And you might be able to share this information with someone else who then can go to somebody as well in person to have an assessment. And then they can use this video if they need to help maintain it and manage it. Okay, so bye for now. You'll see me over there. I'm going to do the right posterior canal next.